cirrhosis, and CAH, chronic active hepatitis. These are the four classes of diffuse liver. And similarly, for the focal livers are pathology which is concentrated in a small area, while the rest of the liver volume remains normal. So focal liver again has two classes, one disease, another one is normal liver. And disease is having solid lesion. That means a portion is solid, hard. Another case, it can be cystic. Cystic lesion is just like pus. When we say that there is some fluid type of structure. So tumor is like fluid in nature, whereas the other type of tumor is like a hard or solid type of lesion. So then again, solid lesions, they are abnormal or cancerous. That is, they are benign or cancerous, malignant. Hemangioma, non-cancerous and cancerous. Then malignant can be primary HCC and secondary metastatic. So these are the type of tumors which we wanted to classify. So we try to study their texture. We started studying the nature, how they behave when ultrasound probe or ultrasound waves are focused on these surfaces. So ultrasound definitely is less sensitive as compared to CT and MRI. When we have to differentiate between cyst from a solid lesion, that means solid liver tumor and fluid type, cystic type of tumor. If we compare CT and ultrasound, CT is definitely more sensitive or MRI is more sensitive. But with respect to the first study, ultrasound is good enough to get the information whether it is cystic tumor or it is a solid lesion. Similarly, ultrasound has a problem. If the size of the tumor is very, very small, then there is a question mark. So keeping these 2 points in mind, we started working further. Uh, Whenever ultrasound is focused on these lesions, one is anechoic. Anechoic means if you focus ultrasound on a dark patch which is liquid type, the ultrasound is absorbed. There is no echo. So when there is no echo, the signal magnitude is very, very less. Second case is hypoechoic. When it is not solid, whether it and neither it is fluid, and surface is not black, it is slightly gray. So we say it is hypoechoic, less echo is there. Then third case is isoechoic, when the surface outside the tumor and surface inside the tumor, they have the same echogenicity or echo texture. So that means ultrasound echo from here or ultrasound echo from the outside the tumor will be same. So in that case, we say it is a isoechoic. Another category is hyper, when ultrasound echoes are not at all absorbed, but they are reflected back. So this is hyperechoic. So four type of conditions are there when we measure the magnitude of the echoes after they are reflected by the tumor. Now, to understand the tumor texture, three things are generally done. One is echogenicity. Echogenicity, what I have already discussed, whether it is hyper, whether it is iso, whether it is hypo or anechoic. So every tumor surface, we will identify which type of echoes we are getting. Second one is echo texture. We say we try to find out three things. One, echogenicity, echo texture, and shape. So echo texture is whether the texture is homogeneous, uniformly distributed. Intermediate, neither it is uniform nor it is heterogeneous, randomly distributed, or in between. So we have homogeneous and heterogeneous, and there is a class intermediate. So we find echogenicity, we find echo texture, then shape, whether the tumor is round, whether the tumor is oval or irregular. The shape is irregular, neither round nor oval. It may be very irregular. So these three properties of the tumor, generally these properties are seen by a radiologist to identify a tumor. We just wanted to convert the knowledge of a radiologist, whatever they see with the help of naked eye or visually, same knowledge we wanted to convert into a computer knowledge so that classification can be done. So see, this is a homogeneous. Homogeneous means, say this is ultrasound of a liver. So homogeneous means, see, this type of pattern we say as homogeneous. Now, how will you find out that this is homogeneous? We take a small patch here, we take a small patch here, we find out its statistical parameters like average value, RMS value, maximum, minimum, then standard deviation, etc. If these statistical value of various patches here, here, they are either constant or change is very slow. That means either they are constant or slowly varying or approximately periodic, up, down, then we say it is a homogeneous. Liver surface is homogeneous or tumor surface is homogeneous. So this is a homogeneous surface. Now cyst will have, one is cyst is anechoic. The center, this is cyst. Anechoic means it is a black area and it is a fluid. When ultrasound is focused on this, ultrasound is absorbed. Magnitude of the echo is almost negligible. Second one, thin imperceptible. This particular tumor, the wall is not visible. This is not visible. This is imperceptible. Acoustic enhancement. Outside the tumor, the outside area of the tumor, outside away from the boundary, the echo brightness is large, high. That is acoustic enhancement. Here the echo will be high, magnitude will be high. From here the echo magnitude will be almost zero. So this gives the idea that it is a cyst, nearly homogeneous, and inside when you find the statistical parameter from this point to this point to this point, you will find they are almost constant or changing very slowly. So we say it is a homogeneous. So a cyst can be identified when it is anechoic, when acoustic enhancement is there, boundary, near boundary, surface is homogeneous, and the boundary wall here is imperceptible. That means it is not visible. So similarly, we do try to study other tumors. So simple tumor is anechoic, well-defined wall, increased posterior transmission. Posterior transmission is this. This is posterior transmission. So complex cyst, there may be internal echoes also. Irregular thick walls may be there, and thick septation may be less than greater than 3 mm. Calcification hardness may also be there. So similarly, there are conditions that simple cyst is very common. Simple cyst is you can say is generally gives no issue, no problem. It is detected by chance when you go for X-ray, ultrasound, etc. And majority are asymptomatic, that means no symptom, etc. is there. So this is the uh, simple cyst. This is a complicated cyst. You will find this is very simple. It follow all the rules or the properties of the cyst, but here these are not. Now, another one is hemangiomas. Hemangiomas, they have a variable echogenicity. You will find echogenicity is not uniform, it is variable. Hyperechoic to normal liver. So normal liver surface is this. This is tumor surface. So you will find it is dark, it is more bright. So it is hyper. So echo is hyper with respect to surrounding. Homogeneous appearance. Inside is homogeneous, and its boundary is close to round. So if these properties are there, we say it is a hemangioma. Similarly, hepatocellular or HCC, in this case you will find variable echogenicity. So nature or texture is variable, irregular shape, its contour is irregular, heterogeneous appearance. The texture is also very heterogeneous. So texture is heterogeneous. Echogenicity is also variable. So in